We ended last time with, I think, a pivotal question, which is interesting, and then we should get to other aspects of your book. But you said that it's not okay that a CEO of a health system should make $30-40 million. There should be a cap on it. Yes?
Let me put it another way. If somebody made the world's best hula hoop and had a factory that made hula hoops, and the entrepreneur CEO took home $40 million annually, that's fine. As far as I'm concerned, that's capitalism. And capitalism is still proved to be maybe the best economic system that a country can have. But when a CEO of a healthcare company makes that kind of money, and the people in his office, his vice presidents and so on, I ask myself, where's that money coming from? It's coming from people who buy health insurance. It's coming from some grants. It's coming from people who are going to receive from the company not a hula hoop, which they don't need, but healthcare, which they do need. And so if the people at the very top of a healthier company are taking home huge amounts of money, I'm saying to myself, the people who they call their clients, and I call them patients, they're being deprived.
So how do you reconcile in your mind the belief that capitalism is a good system, but then also wanting to carve out healthcare and have it play by different rules?
I don't know why it takes such reconciliation. Every system doesn't have to be all encompassing. I give you another example if you wish. Let's say national defense, armed forces, or let us say the police department, or let us say the fire department. If the fire department takes in a certain amount of money, you would expect them to cover fires everywhere. But if they take in a certain amount of money and the head of the fire department takes home the money, somebody's got to miss out on fire coverage. And that's what I'm saying, that there is something like selling something that people can do without, but I don't think people can do in a civilized society without a police force, a fire department, unfortunately, and armed services and healthcare. I think it falls within the guarantees of the Declaration of Independence. This is essential to a society, and I don't think this should be used as an opportunity. I don't mind they're making a good income, but an absurd income, is difficult. It's difficult for me to condone because it's done at the expense of people who need health care.
Okay. So let's dig into a couple of the points there. So the comparison to the fire department or the police department, I'd say that just thinking through this, there seem to be a couple differences in my mind. Difference number one is that these are completely taxpayer funded, right? And they're definitely non-for-profits. They're not private. They're not private industry at all, right? Healthcare, at the end of the day, is or large aspects of it is private industry. Like you said, a lot of those plans come from employer plans and private plans and this, that, and the other. And you do see that there is a difference in the regulation when you have, let's say, a fully funded, like a community health center or something that's fully funded by taxpayer dollars. There typically is more regulation around, how they can make money and who can make money and things like that, and how they can spend money more importantly. And definitely when they get grants, there's a lot of red tape around it. So the question is, do you think that healthcare should be should be fully government managed, just like the fire and police departments.
No, no, I think the government does an excellent job in what it does manage, like the military. But I've never been a member of the fire department or the police, but I've been a member of the military. No, that's a different story. But I think it shouldn't do healthcare because I don't think it'll do it that well.
No,
Uh,
because that was a follow up question. Look at the state of the of everything that they're touching. It doesn't seem
I
to be doing
think
well.
what they do in healthcare in an organized fashion, let's say the military, is done very, very well. And I think the VA has its drawbacks, but it's done very well. And Medicare medical assistance is done well. But the rest who buy insurance, I don't think they're getting their money's worth. And they should get better. And then, I quoted for you all the statistics the last time is that in the 6 or 7 leading global statistics, we're at the bottom. And why? Because people are not getting what they're paying for. And they go into it saying, I have to buy the insurance, which they do if they want the health care, but yet it could be better. Um, I'll give you an example. At the end of my book, I give 10 ways we can maybe take the healthcare upside down and turn it right side up. And one of them is have the basis for the private insurance companies be fraternal institutions. In other words, the Postal Service has their own health insurance. They're a fraternal institution. They have millions who belong to the Postal Service insurance. The Armed Services, USAA, the one I belong to, is a fraternal institution. These people who are at the top of this and who run it very, very well don't take home multi millions. They make home, I don't know what they take home, but they may take home a very comfortable income, maybe more than people would consider comfortable, but not in those proportions. Uh, so that's a solution, is where do you spend the money that you take in? And when the whole thing is run like a business, which today healthcare is, as you know, people call, you don't talk to anybody except a robot. After you get through several robots, you talk to somebody who says you can't see the doctor you saw the last time because he's really not your doctor. He's just provider A, and provider B isn't busy this week. So in our business model, we'll put you into provider B. That's a good business model, but it's not a good healthcare model. It's not good
Right,
service.
right, 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 right. Well, I have two immediate questions, but question number one is, if you take, I think most people, pretty much everyone will agree with you that healthcare has to get better. Healthcare has to change, and I think that there's a lot of people in the country that are working to that effect. But if you take away financial incentive to make to making healthcare better, then you lose innovation. Then you lose the people that have the smarts to come in and come up with new ideas and new initiatives and new thoughts. Because, like you said, capitalism works because what's in it for me? If I'm able to come in and come up with a new idea that's going to change the lives of millions of Americans for the better, then I'm going to do that because I'm going to want to profit off that. That's the way most people think. If you take away that ability, then you end up with a very, whatever the word is, bureaucratic or autocratic, or I don't know what the right term is, but you end up with just a very sterile government structure where there's no ingenuity and there's no novelty. There's no one coming up with new things.
You're giving my argument. Thank you so much. Innovation, let's stay with that. If innovation to do what? In the system before the current top-down system of management control of healthcare and doctors being employees and called providers from a firm. And so in that system, innovation is discouraged, it's quelched, because uh, innovation flourished when the management said, "You got a new idea? Oh, and what's the idea for? Well, we can do this better for heart disease. I have a new catheter, and we can make this catheter and do a lot more for heart disease." Those innovations flourish. But if the innovation is how do we make more money for a management led business model, then the innovation that you really want is discouraged, because that doesn't happen anymore, because people who are strict employees who aren't saying, "Hey, well, go do this, good idea," or it says, "No, I don't want you to do that because our business model is our innovation. We have found out how to make more money in our company in healthcare than the next company." That's fine when it comes to selling automobiles, but the motivation here shouldn't be to selling healthcare for profit. The motivation should be to give the best healthcare, and that's what leads to innovation. So yeah, you give my argument.
So,
Innovation
do you
is.
think there's a world where those? Sorry, continue.
I'm sorry. Say again.
You there? I said, do you think there's a world where those two things align? I'll give you an example. I know somebody. I hope to have him on the podcast soon. he built a he built a tremendous practice with thousands of employees and dozens of locations, and it was a fully risk based practice, which means that he basically was really, really good at the business of healthcare, right? In a way that put patient care first. And he was doing this model that we talked about last time, where he assumed all the risk. You said it was from the ancient Chinese almost, where he assumed all the risk of the patient's health. So he said, I'm going to take $10 for every patient, and now all the patient's health is on me. And I'm going to manage these patients so well and keep them so healthy that I'm just going to consistently keep most of the money, because I'm spending so much money on the preventive and then driving down my acute patients to a tiny margin and only having to take care of those. And now I'm left with 60% of patients that I'm getting paid on that are so well managed that they don't cost me much, right? That's essentially the model. And he built it up and he sold it. He sold it for an obscene amount of money, much more than $40 million. And I'll give you an example of how tremendous this can be for patient care. He was telling me that he had one doctor, a full doctor, full time, making whatever it was, $200,000-$300,000, and the doctor's entire caseload was 7 patients. Why? Because he knew how to cut his data down so well, and his job was to manage his risk and manage his patients. And so he was able to, so he realized that these 7 patients were so out of control that they were costing him, between hospitalizations and readmissions and hospital stays and this and the other, they were costing him $2 million a year, these 7 patients. So he was able to narrow down from thousands of patients to these 7 patients. And he took one doctor and said, okay, these patients are costing me $2 million. I pay a doctor $350,000. And the doctor's entire job is to just manage these patients so well that they peep and they have the doctor's attention. And he was able to do that, right? So I think that's a scenario where you have someone that built a tremendous thing with patient care super aligned with the incentive structure. And now he exited for, like I said, an obscene amount of money. In your book, is that a good thing, or is that a bad thing?
Well, I think you're mixing a couple of things up. You're mixing up medicine going into preventive care from taking care of the sick. And let's go back a little bit. When I started in medical school, I was tremendously interested in cholesterol metabolism and how it contributed to heart disease. And uh, that's where I first did everything I did in research. And I told you the last time I ran this $65 million grant, it was the first one to show that lowering cholesterol increases life expectancy and decreases heart attacks. So when I came to my professors at that time and said, I'm interested in lowering cholesterol and preventing heart disease, they said, we're not in this business. We're in the business of taking care of disease. So I said, but there's evidence that if you control blood pressure and cholesterol and diabetes and weight, you get less heart disease. And they said, that's not our business. Our, we take care of the heart disease. I went to the pediatricians and I said, the kids are getting high cholesterol and they're fat. And the answer I got literally was, we give them to you when they're 18, then it's your problem. So that was medicine in the past. Under a freer system, not the current system of top-down management, preventive medicine came in. And preventive medicine has made such a difference. Today in medical schools, they're talking about cholesterol. They're talking about blood pressure. They're trying to prevent diabetes. Obesity is a big national problem. Preventative medicine is in. And there are lectures and courses and actually clinics. Everything that you said with your 7 patients was put in way before the current business model came in of the ultimate end all is to make money. The ultimate end all was to prevent disease. And so that is something that existed at that time. But now if you substitute the end all is money, I think you're losing sight of the newer innovations that could make this kind of system even better and a population even healthier. So, yeah, innovation, I think, is being discouraged by the money first system.
Okay, so tell me if I'm understanding you right. You don't necessarily have an issue with people making a lot of money in healthcare when it comes from actually making a positive change. You just don't want to see that, and I think everyone would agree with you. You just don't want to see somebody making a bunch of money that comes at the expense of their quote unquote client's product, which is their own health.
I think
Would that be accurate?
that's a fair statement, yeah.
Okay.
I got nothing against people making money. I get it. I'm against people making money at the expense of what people think they're paying for, namely health care.
Yeah.
And,
Yep.
and,
Yep.
and
Yep.
why
And I
do
think
I
that actually doesn't. Sorry. Go ahead.
why do I say this? Because all the statistics show that we have very low health care. I hate to keep saying a third world country. I don't want to insult any country, but we should have the best in the world. Well, we should be at least up to Canada and New Zealand and Australia and the European nations who are on the West European. Why don't we? We pay more. You see, your argument is self defeating. We pay more than anybody and we get less. So that I think is not a good ratio. And even if you, let's say, let's go into the business world, no other business except healthcare, where people are frightened that they're going to get sick and going to die, could exist if they charge more than anybody and give poorer service. And that's what we're doing. We charge more, we give poorer service.
Right.
I don't think that's right.
Right. So yeah, and then that's what I was going to say next. That you're not. That my understanding is that you're not, in fact, pushing any kind of socialist medicine or top-down governmental medicine. In fact, you're the biggest capitalist, because you're saying that in a true capitalistic environment, this product would never sell, and the customers would never be okay with this setup. If you had a phone that you were trying to sell me and you were charging me more than everybody else, and you gave me a terrible phone, I'd move to another company. That's what I would do. So the answer is and so let's start to get to the solution part of your book. The answer would obviously be to create some better solutions for people to counter what is currently available. So, Dr. Buchwald, please, what are some of the solutions for our country?
Well, the solution has got to start with people realizing that their health care is upside down. They got to look at it as if they're going to take their kids to the ball game. And they're not going to buy a ticket that's where the people who run the ball game, the owners, say, we'll tell you what day you can come, which healthcare does. We'll tell you what seat you're going to sit in, which is like we'll tell you who you're going to see. And most important, we'll tell you what team you're going to see. Who would buy a ticket under those circumstances? No one. If you went to a car dealership and the car dealer said, I think I know what you want. No, you don't want that car. This is the car you're going to get. And I don't, you don't have problem with tires, but we're going to sell you an extra tire guard and you're going to pay for it. Nobody would do that. People do that with healthcare. They give their money and then they say, I'd like to see my doctor. You don't have a doctor. Robot number 3 will give you provider number 6 at the day we tell you to. Yes, I'm all for capitalism. I'm for the consumer uh, raising their voice and saying, we want better for what we're paying. So, okay, where? How does this start? Well, everybody has a voice. The individual voice cannot really be heard in this. If, let's say, you're an independent contractor, maybe yourself, you have a very tiny voice. But people who belong to unions have a big voice. And people like the Teamsters, people like the Postal Service, these unions are huge. And if they get together and when they make the next employer contract, and the one thing I left out, when big management took over, the innovation stopped in many a way because they said, we're not going to cover previous heart disease. We're not going to cover that. That wasn't in there before, but that came in to make it more profitable. And now, there are laws against some of this stuff now. So anyway, the unions have a tremendous power, and they should say, now, wait a minute. Our last contract didn't cover obesity surgery, which is one of the fields I'm in. We want it covered. And you didn't cover congenital heart disease. We want that covered. So you work through your organizations. And then the physicians have to pick it up on the other end. A lot of them are happy with being an employee, but people are retiring sooner and sooner. So the American Medical Association, American College of Surgeons, they are powerful organizations. They got to pick it up at the other end. And then you're right, I'm the greatest capitalist. There may be people who say, hey, I can do better. I don't have to take home 50 million, but I can take home 5 million or whatever, and I can do better, and I'll get the customers. So capitalism, the people, the insurance themselves can do better. As I said, the fraternal organizations can do better. Church groups, etc., could do better. because they start off with maybe a different philosophy, like the Veterans Organization.
Mm-hmm.
And finally, there are two other aspects: legislation or government, and I haven't seen much do that. I mean, a lot of people have talked about healthcare reform, but I haven't seen much. So again, we get to the individual. Every one of our legislators is elected. So you got to tell them what you want. And you got to say, if you don't do this, you're not going to get elected. The world listens to the media. You control society. You are more than the fourth estate today. You have to say, listen, this is what's right for our people. This is what's right for everybody. Um, you know, that's where a lot can be done. Is responsible media.
Yep. Yeah. All that's accurate. We've had a bunch of government people on here. And I think we can, I know a lot of them try. I know that genuinely do, but I think that there still seems to be a bit of a disconnect between people that are actually on the ground running practices, medical organizations, medical practices, and the legislation. And it's again, I know they try and they say, email here and go on the website and click this, but I think definitely there's a common thread that I'm seeing with a bunch of these conversations where there's a need for greater coordination and greater communication and collaboration between the government agencies that essentially influence and impact the legislative process and the people on the ground, the people that are actually seeing patients every day. That would go a long way towards communicating what's really necessary to kind of create this change.
And our legislators they'll listen to big voices.
Yeah.
If some organization says, hey, we are 20,000 members and we want you to listen they'll listen. Otherwise, it's very, very tough. I know that every day I get maybe 10, 15 emails asking me for money. Help me get reelected. Help me get reelected. Now, I've written some. I've written some of my own senators and stuff. I don't get a response. They don't have time for me as an individual. So how are they going to respond? Well, if you're fraternal organization, if you're whatever, your veterans organization, uh, there's so many organizations. If they say, I'm the president of so and so, and we have 30,000 members, and this is what we would like you to do, they'll respond.
Yeah. Yep. Fantastic. Well, looks like you put a lot of thought into this, and it's very well thought through. And it's not only thought through, but it's written in a book. People can buy. It's all in the book. Healthcare Upside Down.
It's in there. It's an outline to make people think, and to make people think for themselves, not necessarily to agree with everything I've written. And that's why, basically a scientist. I'm a doctor. I'm a researcher. I've tried to document everything in that book with statistics, with data. And the whole purpose is, this is what it's at. What do you think about it? And what are you willing to do about it?
Ladies and gentlemen, we've had Dr. Buchwald back for part 2, and it has not disappointed. Go grab a copy of his book, Amazon, bookstores, wherever. Healthcare Upside Down by Dr. Henry Buchwald. And this was fun. Thanks for coming back.